If you're about to have a medical specialty interview, this video is going to give you an advantage. In this video, I'm going to go through all the possible questions that might come up in your medical specialty interview, which I hope will help you in your preparation. My name is Sal. I'm a doctor that's based in the United Kingdom that specializes both in kidney medicine as well as intensive care medicine. Now, the first group of questions are what I call the opener questions, which are questions that come in the form of talk me through your CV, tell me about yourself, or what aspects of your CV are you most proud of, which are what are the strong points in your CV that you want to highlight to me that make you suitable for this specialty. Now, the second group of questions are what I call specialty-specific questions. So the examples of these questions are, why are you applying to this particular specialty? What makes you prepared to be a registrar of this particular specialty? Or what qualities does a registrar in this specialty have to possess? What qualities do you think a consultant in this particular specialty have to possess? An example of a question that I got during my intensive care interview was, what qualities are important in order to look after a complex and sick patient in the intensive care unit? Or what is the difference between a registrar and a consultant in this particular specialty? Or what communication skills or styles are important in this particular specialty? Now, the next group of questions is what I classify as the general knowledge of that particular specialty. So examples of these type of questions are, what are the current challenges that this particular specialty is facing at the moment? Or it could be, what future challenges are anticipated in this particular specialty in 5 to 10 years time? Or what does the landscape of this particular specialty look like in 5 to 10 years? Tell me about a research paper that you've read recently that has changed your practice. Now, the next set of questions are what I call curriculum-specific questions. So these questions will come in the form of, tell me about this particular specialty's curriculum. What do you look forward to the most during your specialist training in this particular subject? Now, the next set of questions is what I classify as applicant-specific or CV-specific questions. So these questions will come in the form of, what is your weakness? Or what areas do you think you need to work on? Or what are your strengths? What areas of your training are you most proud of? Or what areas of your skills are you most proud of? Now, the next group of questions are generic questions that will test your knowledge of clinical governance as well as good medical practice. What is evidence-based medicine, and tell me how you've practiced this? What is professionalism, and tell me how you've incorporated it in your practice? How would your colleagues describe you? What is clinical governance, and how have you practiced this? Now, what are the qualities of a good team leader? Or what are the qualities of a bad team leader? What are the qualities of a good team member? Or what are the qualities of a bad team member? What qualities are important in a good teacher? What qualities does a bad teacher possess? What is needed to demonstrate good communication skills? There will be questions about significant event analysis and whether you've been involved in error reporting such as day taxes. Now, the next set of questions is what I classify as current issues. So examples of these questions will be, what is the role of social media in medicine? What do you think about AI, artificial intelligence, and its impact on medicine currently and in the future? How do you deal with stress? What do you think the impact of aging population is on medicine or on your particular specialty? What is your opinions on physician associates? Then the next group of questions will be under clinical audits, quality improvement projects, and research papers. This is quite standard and pretty obvious. And I hope you have watched my previous videos and focus your time appropriately in order to score well in this particular domain. Now, the very last genre of questions will be what I classify as clinical scenarios. And these questions are there in order to test your ability to reflect on incidences that has happened in the past. And these are some examples. Tell me a time when you had to make a decision for a patient who was incapacitated or did not have capacity. Tell me about a time when you had to deal with a difficult colleague. Tell me a time when you had to disagree with another colleague's decision. Tell me about a time when you had to deal with an angry patient or angry relative, or when you had to deal with a relative who did not agree with your plan. Tell me a time when you made a mistake. Tell me a time when you saw good teamwork being carried out, or tell me a time when you saw bad teamwork. Tell me a time when you think confidentiality was compromised, or a time when you felt out of depth, or you felt like you needed to escalate. Tell me a time when harm came to a patient, a time when you had to break bad news. Tell me a time when you had to show humility. Tell me a time when you had to uphold a patient's dignity. Tell me a time when you had to show compassion. Tell me a time when you had to show empathy. Although there are many different types of clinical scenarios that they can ask you about, I found that if you have about 5 or 6 very good examples, you can often use these 5 to 6 examples to answer most of the questions that might come out. This is a pretty comprehensive list of all the questions that might potentially come out in a medical specialty interview. Now, check out this video where I go through how to tell a patient that they're dying. Good luck, and I hope that helps.